Hi, Dr. Corey Maas on Looking Your Best. I wanted to take a few minutes today to answer some questions we had from a number of patients about how we can fix ears or improve the appearance of ears. And there's a few categories of ear deformities, if you will, that I can classify and explain a little bit about how we address them. The simplest of the ear deformities that I see with great frequency is where an earlobe has been torn through or the actual piercing hole has been enlarged. And there are a couple of approaches to doing this. The simplest of them is obviously to just take out the hole by doing a little wedge, or if the hole is large enough, take the entire wedge out and close the ear so that it's nice and continuous right along the border of the ear. The most important thing about that is that we keep a nice round and continuous shape to the earlobe itself with no step-offs. Traditional approaches, the wedge that I just described, will often lead to a little notching as the scar contracts. So there are a couple of strategies that I employ, including a Z-plasty type of procedure, which adds a few minutes to the correction, but that can be simply done in the office in an hour or less. And doing a Z-plasty or a little notch type of correction are good ways of improving first correcting the hole and then improving the overall shape of the ear. I re-pierce everyone's ears with careful marking after 6 to 8 weeks. It's had a good chance to heal, and with this technique we can pierce it virtually anywhere we like, including in or along the line of the scar. So fixing the ear lobe deformity that's associated with the ever so common pull-through effect on the ear is something that we do with frequency and good consistency, and that's fairly simply done in the office. The second type of ear deformity that I see with some frequency, and I see this through all ages of life, are ears that we refer to as outstanding ears. And the ear that's outstanding is one that the concha, or the bowl part of the ear here, is either enlarged or too long, or the portion that is represented by the curve or the small ridge in the ear we call the antihelix is malformed or even not formed at all, which results in the ear sticking out to the side. And those outstanding ears are often identified early in people's lives. In fact, around the time that many children are starting elementary school, they've been the subject of criticism or ridicule by their peers, and often parents will bring their children in if they're significantly outstanding so that they don't have to suffer from any kind of childhood teasing. Later in life, it works the same way. The procedure is a same-day type of operation that can be done both in children and adults in local or sedation anesthesia, or we can have a light sleeping type of anesthesia in some kids if it's necessary. And when that procedure is done, all the incisions are performed behind the ear. In fact, there's only one incision. The work is done behind the ear. I reshape the cartilage with a couple of special techniques which are non-cartilage splitting, and that means that the ear itself in the front area maintains its nice round shape without any sharp edges or marks of the surgery itself. And because the scar is well hidden in the crease behind the ear, there's really not very much to see. Probably the most difficult part for people in this type of procedure is that they have to wear a headband and a little pack that I create for around the ears for as much as they can during the first week after recovery. But a relatively simple procedure that requires some art and some expertise to get a really nice result that's long-lasting. Typically this is something that people do once in their lives. Often I'll do this in combination with other procedures. In older patients, for example, that are having facelifts, we'll address these things that have been addressed at some time, never been addressed, at least at any time in their life. And in combination, they end up being quite a nice combination of procedures that allow women in particular, and in some cases men, to wear their hair back in ways that they've never been able to wear them before. The last type of procedure, and I'll show some examples, by the way, of that in just a moment. The last type of procedure that is more extensive, and I've done a fair amount of this, which is a very special kind of surgery, are people who are either born without ears or people who have had their ears completely or near completely removed from cancer or other types of diseases. And the types that are created with kids that are born without ears are called microtia. And there's a special whole set of systems that we use to create the new ear framework by borrowing the patient's own rib cartilage and carefully shaping it in a series of of operations that create both the framework for the ear and the appropriate tissue for the ear so that we can actually get the shape pretty nearly accurate, and those ears, and I can show some examples of those that I've reconstructed also, pretty nearly what the other ear looks like. So in all, most of the procedures I do are smaller types of procedures to fix the earlobes that are deformed from trauma or from some type of earring injury or enlargement of the piercing. And in those patients that have an outstanding ear where the ear sticks out, both of which are fairly simple, same-day types of procedures. So if you have any questions about those procedures or any other ones for that matter, please feel free to send me a photograph, a video, or even a written message describing the condition to drmaas.com, and I'm very happy to either share them publicly or privately. And as always, thank you for checking in. Dr. Maas on Looking Your Best. In our discussion about outstanding ears, I thought I'd point out a couple of example patients. And this patient who came in with primary complaints about the aging lower face, you can see here she's got some early jowling effect here. The chin line or jaw line becomes bumpy. There's a downturned corner of the mouth and some deepening of the nasolabial fold here. And I've got her before picture shown here on the left. And then over here on the right, I've shown her after picture, and this is just a few weeks after the surgery. But you can also see that her ear sticks out, and she wears her hair longer. It's pulled back behind the headband here. And what's absent in the picture that you can see causes her ear to stick out is this ridge that we refer to as the antihelical ridge, or the antihelix of the ear. In her post-operative picture over here, you can see that by making an incision behind the ear, I'm able to reform the antihelix, which actually in its uppermost or superior portions becomes something of a Y. So there's a superior crus and an inferior crus to the antihelix and a scaphoid fossa in between. And I'm able to recreate those features to the ear by doing the procedure that's called otoplasty. And so this allows the ear to be set back a little bit so that it's more natural appearing and doesn't stand out, allows the patient to have a shorter hairstyle, as you can see here. And of course this is a post-operative image showing the improved jawline and obviously a much more youthful and happy patient in the post-operative picture. I'm going to show the next slide here from behind, where you can see this patient. And in the picture from behind, you can see this patient where the antihelix, I'll start again, in the posterior, or picture from behind, you can see how the upper portion of her ear really stands out. And she, of course, wears a longer hairstyle. It's tucked underneath this headband now. But this portion is corrected with an incision way back here in the crease behind the ear. And her head is slightly tilted now to her right, which shows a little bit more of a right ear, but they're perfectly symmetric if she was straight. And you can see that, again, that was done in conjunction in this particular case with a lower facelift. And the before and after pictures here show the reconstruction or reconstitution of the antihelical area of the ear. So that's a very common approach. In an older patient, obviously it's very similar anatomy in children, but one that we can get reliable results in. And very commonly children will do this with their parents, obviously, if it bothers them. And it's only if the kids are bothered by it, of course, that we do that in. But around age 6 is a very common age. The ear is about 90% its original height and dimensions by about age 6. So we can do that without any worry about having ears that are too small or need to grow much more. So that's a little look at otoplasty, one of the 3 types of ear surgery or ear corrections that we talk about at the Maas Clinic. Again, Dr. Corey Maas on Looking Your Best.